Hi, this is Dr. John Martin. Welcome back to my videos. I took a brief hiatus with my grandchildren visiting Las Vegas and my children from far and away visiting me. Now I'm back to recording videos that I think are helpful for women with common questions that I've received in my over 20 years of practice as an OBGYN. This video is going to be on infertility. Doctor. I have been told by my handlers, which are my family and my youngest daughter who is editing these videos, I need to be a little bit more expressive and a little bit more lively, I guess. So I'm going to try to do that with this video. Infertility seems to be a very hot topic when people are asking me questions. So I wanted to kind of cover some what I think are very superficial areas of infertility that I think are important for everybody to understand. Number one, a general OBGYN like myself is trained in infertility, but not in great detail. What happens is people will do a residency in obstetrics and gynecology, and we do learn infertility in that. But what really comes about is they do fellowship training as a reproductive endocrinologist infertility specialist. So what we call the REI. And those are infertility specialists. But your general OBGYN can help you with many common infertility problems. But also I think we learn because we're dealing with women who are going through these struggles, and certainly they are struggles. There's a lot of anxiety and a lot of difficulty through going through infertility. So that's the one thing, is you want a physician that is understanding of that and empathic about that. And that I think is important to find that physician to connect with. And you should also expect the same from a reproductive endocrinologist infertility specialist as well. So common questions, I think the number one thing is, what is the definition of infertility? Well, there are many causes of infertility, and I'm not going to go into great detail with that. I can later if people want to do that. But the biggest simple thing is, if you have unprotected intercourse for 12 months, 80% of couples should have at some time during that 12 months conceived. So 12 months of unprotected intercourse without conception is the definition of infertility. Now, because we say 80% conceive, that means there's 20% will take a little bit longer. But on the short side of it, the average couple without any infertility issues usually takes 3 to 6 months or 3 to 6 cycles to get pregnant. I think that is really an important thing to remember, because when women want to get pregnant, they want to be pregnant yesterday. And so it is important to have patience about that. And really 3 to 6 cycles at the minimum, but it is 1 year of unprotected intercourse is that definition of infertility. Also, there's a lot of common misconceptions out there. Your girlfriends will tell you, don't have your husband or boyfriend wear whitey-tighty underwear, whatever it is, bun hugger underwear, whatever you want to call it. But the truth is, nothing matters with that. There are some medical issues that are related to males, and we'll get into that a little bit, but their underwear does not matter. The other misconception is men do not build up sperm. A man doesn't, if you have him not have sex for 2 weeks, he doesn't have more sperm. In fact, what we know is roughly within 72 hours, a man's sperm count will decline. So it's important that is the peak. And it's okay to abstain for that 72 hours, but after that, it doesn't produce more sperm. No position matters. Your girlfriends will tell you, stand on your head, do it in this way, all that. That doesn't matter. So don't listen to that. Lastly, I think a really an important concept is everybody has sympathy and empathy for the woman who's never had children, who goes through infertility. But I think one thing that's I see, and I think women want to really understand, is infertility is in the eye of the beholder. And what I mean by that is that if you have 6 kids and you want to have a 7th, it is still infertility. Some people don't have compassion for you when it comes to that, because they think, hey, you have your 6 kids, you should be happy. But if in your brain you wanted that one more child, it does make it difficult on women to go through that. So I think it is important that always have compassion, whether it's somebody trying to have their first baby or their 5th baby. If they are struggling through infertility, they need your compassion and your concern and your understanding. I hope this video has been helpful. If it has been, please share it. Follow me on Instagram and Facebook. Share it with your friends and have them watch my other videos. I'm really trying to develop a following of getting word out there of common questions in infertility. Thank you very much. Be safe, be kind, be well. Thank you very much. Bye-bye.
Doctor, doctor, you gotta help me.